Okay, so today we will be revising on the topic of deep vein thrombosis. That day, you all said, no? Like you all means for one student, like she mentioned about deep vein thrombosis, which will be taken in the revision class. So today we will be discussing on the topic of deep vein thrombosis. Can you see the screen? Is it visible?
Ma'am.
Okay. Okay, so today we will be discussing on the topic of deep vein thrombosis. So from the name itself, deep vein means vein. It's related with vein. It's not it from the name itself. And the vein is of what type? Deep. So obviously it will be this type of abnormalities will be located or it will be present in deep vein thrombosis. Understand? So it will be in the deep vein. Okay. So what do you mean by deep vein thrombosis? So deep vein thrombosis, which is also known as DVT, it is a, like a serious condition. Understand where the blood clot is being formed. So this is a normal blood flow. In the picture, you can see it. This is a normal blood flow. Like this is the valve where the veins open. Listen, when the veins open, so this is the normal blood flow, and like they go very much normally if we go up. It's not it. But in the deep vein thrombosis, what will happen? Since the veins are weak, or maybe because of some conditions, uh, like say for example, yeah, it's weak, or else maybe because of some certain conditions, there occurs blood clot in this place. So because of that, what will happen? The blood won't be able to go anymore. Understand? There will be blood pooling. Means pooling means what? Accumulation of blood because of weakness in the vein. Understand? Means since the vein is not strong enough, like to take out all the blood towards the heart, so that's why there will be blood clot. And unfortunately, the blood won't be able to go uh, as it is required. And this deep vein thrombosis, it mainly occurs in your thigh portion, is in your lower leg. Understand? Means in this portion, it usually occurs. And they can also develop in other body parts also, but you will see mostly in your leg portion. Understand? So this is the scenario you can say, like uh, about the deep vein thrombosis. This is a slide you can say about deep vein thrombosis. Is it clear? Is it clear or not? Yatu likha, is it clear?
Yes,
Yatu?
ma'am.
Okay, okay. So obviously you will see some sign and symptoms. It's not like if there is any abnormalities in your body, so obviously you will find some symptoms. So what are the symptoms that you will find in DVT, also known as deep vein thrombosis? Okay, so the first one is heaviness and swelling on the leg. So a person will feel like heavy since the leg is swelling, na? Since there is accumulation of blood, since there is clot in the since there is blood clot, so the person will find like the leg very heavy, and because of that, what will happen? There will be swelling also. Since there is blood clot, so there will be swelling as well as the person will feel heavy. The next is pain or tenderness. So the person will feel pain in the leg. Understand? The person will feel pain and as well as tender. Tender means what? Sensitive. You can say like if you will touch like little bit. of that portion, like the affected affected portion, like the person will feel pain. Understand? Very much sensitive. So tenderness, it means that. Okay, next is skin discoloration and ulcers. So there will be occurrence of a skin discoloration also, like the skin color will change. Understand? The skin color will change, and ultimately, what will happen? Uh, there will be some ulcers also. Ulcers means what? Inflammation. Yeah, understand? Since there is blood clots, so the skin color will change, and as well as there will be ulcer also. Skin, yeah, inflammation. And the next is a warm sensation. So that portion, the affected portion, will be warm. Means it will be hot, you can say, compared to the previous or the normal neck. Na? So that portion will be warm. And the skin color, it will become pale. Okay, skin discoloration will be pale, means very dull in color. And the person will feel pain in the calf muscle. So this is the calf muscle. Okay, so this is the calf muscle, and the person will feel pain. Means in this calf muscle, like cramp or soreness. Means contraction. The person will feel some kind of contraction, that is cramping, or else soreness. Soreness means it will swell. It means it will pain in the calf muscle. Okay, so till here it's clear, everyone. Yes.
Yes, ma'am.
Okay. Okay, and also you can find some symptoms also. These are some like extra ones I have included. So there will be swelling. I've already said this is the normal leg, and this is the like DVT, that is a deep vein thrombosis leg. So it will swell. You just compare the normal leg and the affected one. So it's puffing out, right? So this is not normal. Next is pain may worsen when standing or walking. Means if a person will stand too long or else will walk for too long, then it will pain. The next is warmth and tenderness. Means I've already said this. There will be redness, and as well as the person affected leg will be warm. This is also the same thing. Okay. And the next, okay. And the next, like cause, I mean, abnormalities that we will find in the DVT, that is deep vein thrombosis, is pulmonary embolism. Pulmonary embolism. So in the pulmonary embolism, what you will find that uh, since there is blood clot in the DVT, means in the leg portion, na, so that blood clot, what will happen? It will come and travel. Obviously, the blood will like go to the heart, towards the heart, isn't it? I've already said in the circulatory system. So since they will go upside, okay, like that blood clot, which is known as the embolus. So the blood clot will go upside. They will travel upside through your vein with the help of the vein. Like they will go towards where? Towards your lungs, towards the lungs. And when those blood clot, or else you can say embolus, it will go towards the lungs, what will happen? The person will find difficulty. The person will find difficulty in breathing, as well as the person will find like difficulty in what? Like not difficulty. The person's circulatory system will also will be disturbed because of this blood clot. Since there is blockage, right? I mean, obviously, it's not normal. All these things are not normal. It's not it. So the blood is normally like in liquid form. You can say it like goes fluently towards your heart, not like in the clotting manner. It's not it. So obviously, the normal function will be disturbed. So it will disturb in both these two visceral organs, that is the lungs and your heart, since these two organs are nearby each other, na? So obviously it will disturb. So pulmonary embolism. Pulmonary, it comes from the word lungs. Understand? And also you will find some symptoms in the pulmonary embolism. So what are the like changes that you will find if a person is having some pulmonary embolism? So there will be chest pain. The person's chest will pain since their lungs are located. No? So the person's chest will pain, as well as the person will find difficulty in breathing. Listen, and there will be shortness of breath also. The person will feel, I mean, the person will breathe very much abnormally, like very short. And obviously, the heart will also the heart will also be affected. It is rapid heartbeat. Okay, and rapid breathing means the person will breathe like very fast, and there will be sweating, anxiety, and there will be coughing up blood. The person will cough out blood since in the lungs there is the blood clot. No? So if a person will give pressure, obviously you used to give pressure or not when you cough with full from the internal side, like you give pressure. It's not it when you cough out. So same thing when you will when the person will like give force like from the lungs, what will happen, like when the person will cough from the internal side, the blood clot will also will also come out since there is blood clot in the lungs. It's not it. So because of that, the person will cough out blood. Next is fainting. Too much. The person is having too much anxiety, uh, too much scared and all. So by seeing that, like the person will also become weak. So because of that, like the person will faint, like loss of conscious. Behosh hona. Next is heart palpitations. The heart will like pulp, na means what to say. The heart will beat very fast. Signs of shock. So it will lead to shock also. Obviously, it will lead to shock because there is no proper blood circulation. So there will be signs of shock. Okay, is it clear about the symptoms of pulmonary embolism? Yes?
Yes, ma'am.
That's great. So these are some extra points that I have given. That is unexplained sudden breathlessness, like the person will find very much difficulty in breathing, then sudden sharp chest pain, the chest will pain and coughing out blood. Okay. Okay, and the next symptoms that you will find is post-thrombotic syndrome, which is also known as phlebitis. Understand? So same thing only, like this is just the post one, like after this deep vein thrombosis, like this kind of syndrome can happen, or else you can say syndrome can occur since there is damage in the like the this one veins. There will be occurrence of blood clot, and uh, the blood flow also will be less. And what will be the side effect or what will be the cause? The cause will be like pain, swelling, then discoloration. Can you hear me, students? Am I audible? Can you hear me? Am I audible?
Now,
Okay. Okay, what I was saying means since there is like disturbance in the blood flow, na, so all these are the like signs. I mean, some changes that you will see in the leg. So all these pictures that I'm showing you is because of this deep vein thrombosis, that is post uh, post-thrombotic phlebitic syndrome. Okay, these are some of the pictures post-thrombotic phlebitic syndrome. Okay, so these are some of the legs which which are mainly caused because of deep vein thrombosis. Okay. So the next is risk factors. So who are at the risk of having this DVT? Means किस किस को ज़्यादा होने का chances है ये DVT? The first one is cancer. Cancer, why? Because there is abnormal growth of cell, so that's why there will be they are at the risk of having cancer, deep vein thrombosis. Next is smoking. If a person smoke too much, obviously it will affect the lungs, and yeah, because of that, it also affects the lungs. It's not in the GVT, that is pulmonary embolism. So because of that, it will hamper. Next is long-term use of hormonal drugs. So if a person use too much of like this kind of drugs, understand? Say for example, contraceptive medications. So because of all these, also like the person can have DVT. Next is prolonged bed rest or else prolonged sitting or else prolonged standing means if a person lie down on the bed for too long, if a person is lying down sorry, if a person is sitting in one particular place for too long, or else if a person is standing in one particular place for too long, what will happen? There will be like the blood circulation will hamper because for rich in blood circulation, what you need to do, you need to do something, some activities, right? Say for example, exercise or else any work like domestic work also you can do it. So all these kind of works you need to do some activities. So it is because of all this reason like there can be occurrence of DVT since there is no proper blood circulation. So that's why DVT can occur. Next is pregnancy. In pregnancy, what you will find is in there is hormonal changes, hormonal changes in the woman or in a lady. So that's why it will hamper. Next is injuries and fractures of the leg. So since the leg is injured or is fractured, so there will be disturbance in the blood circulation, some internal bleeding is going on, so obviously in that thing also like it will affect. Next is varicose vein. So because of this varicose vein also like we have already discussed about this varicose vein also, so same thing, abnormalities in the vein. So because of the varicose vein also it can occur. Next is obesity. If a person like is too much fat, overweight people, so it can hamper. Next is over 60 years, like if a person is too old, what will happen? The veins will become weak. So that's why it can cause DVT. Next is a genetic predisposition, like it occurs genetically also. Next is injury or surgery, so same thing, like since there is internal bleeding, so that's why will get disturbed. Next is stroke. So because of stroke also like there is no blood proper circulation, so that's why it will hamper. Next is heart failure. Like if a person blood circulatory system will be affected, what will happen? Obviously they will be at the risk of having DVT since there is no proper blood circulation. That's why. Overall, you can say since there is no blood proper circulation, that's why like DVT occurs. Is it clear about the risk factors?
Yes, ma'am.
Okay. Okay, next is prevention. How can you prevent yourself from not getting DVT? Okay, first is weight loss. It also, I said no obesity. So the person should check his or her weight for time to time, and like the person will have to lose his or her weight because there's too much fat, inside him or her. That's why. Next is exercise. The person should perform some exercise for what to say, for blood circulation, for rich in blood flow. Next is they should wear some comfortable shoes. They should not wear like uncomfortable shoes, because if they wear like uncomfortable shoes or else tight shoes and all, what will happen? Obviously, the blood circulation will be affected. So that's why they should wear comfortable ones. And then next is physical exercise. So same thing like exercise. They should do that. Next is they should avoid harmful habits such as alcohol, having tobacco, such as cigarettes and all that. No, all this prevent. Okay, so here are some exercise that a person can perform if a person is having DVT. Foot pumps, like since suppose this is the foot, so they can pump the foot like this. Okay, they should move like that. And next is knee lift. They should lift the knee. They should like rotate like this. Next is chair leg raise. So they can raise their leg also like this. And by raising the leg like this, same thing, they can do circular motion like that. Next is ankle circle. So suppose this is the ankle, so they can do like this. Okay, so these are some of the exercise that they can perform sitting wise also. They can sit and they can perform like this kind of activities. Next is foot exercise. So even by lying down also, like they can perform some exercise. That is point toe, like this is the suppose this is the feet, and they can point the toe and they can stretch like this. Okay. Next is the lift toe upwards, so they can lift the toe like this. These are your toes, so they can lift like this. And the third is clench toes. Suppose this is your feet, so the clench means like this, like this. Means you can bring all your fingers, not fingers, like your feet one. You can do like this, and you can clench like this. Next is spread toes like this. You can spread it. Next is rotate the ankle. And next is you can fold your legs in this manner also. Means alternatively, you can do it a right leg and left leg like this. Alternatively, you can do it. So these are some of the exercise person should perform. Is it clear about DVT, deep vein thrombosis?
Yes,
Okay. Any more doubts in any topic? Any more doubts in any topic which you want to discuss? Yes? Everything is clear. If I ask you any questions, will you be able to answer from any topic? If I'll ask you, yes? Will you be able to answer? If I ask you any topic, I mean any questions from any topic, will you be able to answer? Yes or no? Peritoneum. Okay, wants to. Okay, peritoneum. Okay, peritoneum, I'll explain in the next class. Okay, since I need to prepare slides also, no? I don't have slides in peritoneum, so I need to prepare some slides in the peritoneum. Any more doubts? Peritoneum topic. Any more? Any more? Any more? No. Yes or no?
Hello, ma'am.
Yes. Yes, Divyajit say.
Cardiovascular system.
Cardiovascular system. Okay, so far I got three topics, that is cardiovascular system, peritoneum, and blood flow. Blood flow chart, are you talking about kidney or else uh, about heart? Virginia and Darshana. Which blood flow? Kidney or heart? Yes, kidney or heart? Kidney, okay. Okay then. Next day we will explain about. We will discuss about this. Okay, that's all for today's class. Tomorrow